Good morning.
Good morning.
How are you today?
I am doing well, thank you.
Your name and date of birth?
So my name is Jake Smith. My date of birth was May 3rd, 1982.
Okay, great. So first step again is to clean your hands before you even touch the patient. And then you're going to put your gloves on before you touch the patient again. Meantime, I will have you stretch your arms out so I can assess. Okay. Now, just by looking at the surface here, it's hard to tell. So what I'm going to do is put the tourniquet on, and I'm going to stretch your arm right out. Again, 4 to 6 inches above the site you're going to draw from. And I'll have you make a fist for me. This just helps me to palpate and feel the vein. So I can feel it. You can't really see it, but I can feel it. And you go by just pushing your index finger lightly like this. Some people have really deep veins that you're seeing. You'll have to go by feel and not by sight. Okay, so I found my vein. I'm going to take the tourniquet off, and you can relax your fist. Next step is to clean. Again, start in the middle and work your way out. So while that's drying, which it has to dry for 30 seconds, I'm going to get set up for what I need here. So your tubes, your gauze, and today I'm going to demonstrate a straight needle stick. So just get everything ready. Now put the tourniquet back on and have your patient stretch out the arm as much as possible. You want it flat. So, and remember the order of draw. In this case, I'm drawing a tiger and a lavender, so tiger top is always first. So with this, you're going to pull this back, pull out, and I usually just put this in here like that. And notice how I'm holding the vacutainer. These fingers underneath, thumb on top, index finger holding the vacutainer. So again, most important, anchor your vein, which means pull down, and then you don't really want to go too much at an angle because his vein is pretty much on the surface. So you want to enter on the lower part of the vein. Okay, and then I'm just going to pull down on the skin, because when I first went in and pushed the tube on, it didn't start flowing. You pull out gently. You can pull the needle out a little bit or pull down on the skin, and that's what made it start to bleed for me. So this is mostly done filling. Take the tourniquet off, take your tubes out, hold the gauze lightly and pull straight out. That. Have the patient push pressure. Invert your tubes 6 to 8 times slowly. Then you're going to check the patient again to make sure they're still not bleeding, which it doesn't look like they are, so push that. And I will give the patient some paper tape. And you just tape it like that. And that will stay on for about 10 to 15 minutes, and then it should be fine.